Namaskar, everybody who has joined us today on the auspicious time before Ram Navami. Today is also Durga Ashtami. Very, very delighted to have you all. Thank you so much for joining. We understand that you have many other priorities, and we appreciate you taking the time on a Saturday morning to join us for our weekly discourses. This week, we are indeed very, very privileged to have Dr. Hall Murthy from our own South Florida attending us and giving us wisdom on daily lifestyle activity. A couple of words about Dr. Murthy, and then we'll talk about daily lifestyle activity. And then Dr. Murthy is going to talk a little bit more on the physical aspect of it. We will host another session on the 17th, a week from now, on Sunday at 9:30 to do the mental and emotional part. So we will do a review and then go on to that from 9:30 to 11 next week. So by way of background, Dr. Murthy was born in Karnataka and he traveled many countries to come to the US. So his journey began in India.
Don't hear you.
A little bit of disturbance from my grandkids. I'm sorry. Hello. I'm sorry. So Dr. Murthy comes from Karnataka, and he got his medical education in London, and then he went to Newfoundland, and from Newfoundland, he came to us. He is associated with several hospitals over here, including his own practice that he has. And he is a teacher at UM, and he's been on the staff of Baptist for about 35 years. So he's uniquely qualified to talk to us about integrative medicine, which is his specialty, because that really combines the medical sciences and the integrative, the softer science. But he will today talk to us about how this is really not mysticism, but it is all rooted in science. His family is based. He is father of our eminent Surgeon General of the US, Dr. Vivek Murthy. His wife and his daughter are in Florida, involved in his practice as well. He is also the founder of an incredible foundation called Scope Foundation, which does a lot of good work for women and children and humanity in general. The mission is to really connect humanity. And he's taken on a new project, which you would be very interested in knowing, which is supporting planet Earth. This is unique in its way, that Scope Foundation, he's building a monument in his home state of Karnataka, between Mysore and Bangalore. Which will create the very first monument to Mother Earth. Mother Earth, or our planet, is really responsible for all the goodness that we enjoy in life, and it's about time that we revere her as she deserves to be. Dr. Murthy, I could keep going on for a long time, but I will turn this over to you so that you can give us your introduction and your wisdom, please. Namaskaram.
Thank you. Thank you for the wonderful introduction, Shafali, and welcome to all of you. And I would like to thank the board of directors of IHU and also all the organizers, including Shafali, doing an excellent, efficient job here and giving me this opportunity to share my thoughts with reference to the daily lifestyle activity. Before I go into the daily lifestyle activity, I would like to share with you some of the things what we are doing in general with respect to planet Earth and also with respect to the humanity. So whatever the subjects what we are going to discuss, these exercises is for the physical body and the mind. A lot of us we don't do the physical exercise. Those who do that, so according to the statistics from the CDC, it is only 22.9% of the people does the physical exercise. And that too, it is considered as the exercise if they devote 150 minutes a week, which is not a lot of exercise time, okay, per week. And if they do the aerobic exercise, these individuals, if they spend 75 minutes a week, they are considered as exercising people. So it is a very minimal, but still, it is only 22.9% of the people does the exercise in the United States. So we would like to emphasize body is important, but the controller of the body or the captain of the body is the mind. So out of the 22.9% of the people who do the physical exercise, less than 1% does the exercise for the mind, what we call it is an active relaxation of the mind. This program is composed to give you the information how we can do the physical exercise by devoting 1 hour for ourselves at the level of the body and also at the level of the mind. It is called BMI, body, mind, and intellect. Today, in the interest of time, I will be discussing with you only about the body. Excuse me for 1 second, please. So about the body, all the things what we are going to discuss here, we are trying to show the humanity across the world. Some of these practices are all scientifically based. There is no mysticism here. In the next session, I will explain to you all the experiments I have done as a science so that our children can accept it without any reservation. Now, when we talk to them about doing the puja, doing the worship and other things, they would ask all the questions because they don't believe in it, they will not be able to practice it. So in the interest of the future generation across the world, we need to take away the barriers, whatever is existing across the world, and also show them this is a science-based information, how it is going to be benefiting them. So today we will discuss that with reference to the physical body. This is briefly, I want to share about the Scope Foundation. So we are building this monument in India. So this is the first monument of its kind in the world for the Mother Earth. We have millions of temples, millions of churches and synagogues and everything, the gods and the goddesses which we have never seen. But the Mother Earth is a goddess. We see her every day. We are only taking the things out of her in the material sense without any reverence or respect in the spiritual sense. I will also show in the next session how spiritually she is energized in addition to the resourcefulness of her materials. This is the eastern entrance. This is the western entrance. What we are also doing is, because it is a global architecture, we call it Bhudevi Adhyatmika Kendra. Bhudevi Adhyatmika Kendra. We have the global architecture. We have the globally who serve the humanity. We call them humanitarians. We don't call them saints or priests or anything. These are the humanitarians. And all of these humanitarians, a total of about 64 of them, we will be carving them around the wall, on the walls, 8 on each side of the wall. This is the Western architecture. This is the Central Asian or the Thai architecture. And this is the Middle Eastern architecture. This is what we have. We can discuss this. I have a separate presentation for the Scope Foundation. We can do that. I would not want to take away your time here. Okay, now coming back to the physical exercise. Why do I say we need to devote 1 hour for ourselves? If we do not devote our time, our total time will get distributed to the different aspects of life. Sometimes it is very trivial aspects of life. Okay, just to have certain minuscule thing, because we are not committed to do the exercise, we will spend the time and we are busy there. But if you have a discipline and a commitment, this particular 1 hour, just like 9 to 5, I need to go to the office, I need to see the patient, because I have an organized discipline, there is no room for manipulation there. So if you do not have the discipline for the self-care, we do not do the exercise properly and we neglect ourselves. As I said, only 22.9% of the people does the exercise with all that discipline. So it brings the best out of everyone if you have a discipline. It creates the conditioning of the mind. When you are keep on doing the same thing, it creates a center in our brain, and that center will actually compel you compels you to do the activity, whatever you are supposed to do. Otherwise, the persons will be very distracted. Let me give you just an example of a tennis shot. A tennis shot, if they keep on practicing every day, it makes it so easy for them. If they don't practice even for a week, they become rusty. The center in the brain knows how to coordinate the physical body and then produce the shot. Same thing is true here. If you do it and you're disciplined every day, if you do not do it, it becomes rusty and vanishes away. If you do it every day, it will be helping you to maintain your health. One of the biggest problem of self-care is manipulation. We manipulate ourselves when it comes to caring for ourselves at the body and the mind level. I will do it tomorrow because I need to go to the office earlier today. I have children to take care of. I have to drop off the children. Some other excuses. It is too cold, it is too hot, it is raining, all of these things, But if they are committed, all of these obstacles will vanish. By doing it, you generate the energy at a higher level every day and helps to cultivate a self-reliance. When we are so organized and energized every day in the morning, we rely on ourselves very well. It is a simple solutions for many complex problems. Just to give a statistical information about United States and how we consume the food, how we spend the energy. Total calories consumed by the United States by people is 815 billion calories every day. And we are the second highest calorie consumers in the world. Second highest calorie consumers. Out of this 815 billion calories, 200 billion is in excess. We don't need 800 billion, we need only 600 billion. And that will feed 80 million people every day if you do not consume excessive amount. And USA throws away 200,000 tons of edible food every day. We throw away so much. So we are a wasting society, and also we are excessively consuming society, but not burning the calories what we consume. As I already said, 22.9% of the people will only do the exercise every day. Okay, even though exercise is a good one, but the food is a good one, but if you do not consume the food in an appropriate manner, it can be a killer. Same thing is true with reference to the physical exercise. There are three components we need to follow to make the best optimum benefit to ourselves and also not to hurt ourselves. One is the warm-up, second one is the aerobics, and the third one is the cooling down. I will explain to you scientifically why these steps are very important for us to get the maximum benefit without hurting ourselves. When we start thinking about physical exercise, the mind thinks about the exercise, the brain registers it, and it has to send the signals to different organs because our body demand through the exercise is much more different, much more higher. The heart has to work much harder. I'm just showing you the complex picture. How many organs has to get ready to support the exercise for the higher demand what we have. The heart has to be supported, the lungs has to be supported, the gastrointestinal tract has to be supported, the liver has to be supported because that is where the storage of the energy is, adrenal glands has to be supported, and also the nervous system, the sympathetic and the parasympathetic system cuts off certain non-essential supply to different organs. For example, it will increase the supply to the muscles when we are doing the exercise, to the heart, to the lungs. But when the exercises are done, intestines does not need the blood supply. It takes away the blood from the intestines and then supply it to the other organs where it is needed. All of these things has to happen. That will happen when we do the warm-up. Next, the other thing, what happens when we do the warm-up, the muscles becomes warm. When the muscles become warm, the blood vessels get dilated, the blood flow will start increasing. The temperature will also increase the stretching of the muscles and also the flexibility of the ligaments in the joints. So spraining of the joints or the breaking of the ligaments will be minimized when we do the warm-up. So those are the reasons we should do the warm-up. So when we do the exercise, what are the benefits we get? We do feel sense of well-being. After the exercise, we always feel good because of the certain hormones what we release. It helps in the weight control. The posture, the person who does the exercise on a regular basis maintains the weight, okay, they would have a good posture, flexibility of the physical body, the joints and other things, and also improve in performance because their energy is so high at the level of the body and also at the level of the mind with our DLSA practice. And also they have a long endurance. In addition to that, they have a reduced risk of osteoporosis. There are a lot of benefits with the exercise, including prevention of the cancer. I will share that with you in the next few slides. When we do the exercise, we are consuming limited amount of calories, not overindulging, because the exercise itself will stop you from overindulging and excessive eating. And also it will distribute the calories, all the old calories what we consume, it will be burnt out by the exercise, and the new calories what is coming in, the nutritionally it becomes very well balanced. It also reduces many types of cancers, especially a lot of work has been done on the breast cancer. I will share that in detail later on. The reason it reduces the incidence of cancer, this is the report from the American Cancer Society. When we do the exercise, the inflammation in the body gets reduced. So when the inflammation is reduced, inflammation is like a war zone within our body. When there is a war zone, we can have a small inflammation, we can have a greater destruction, just like what is happening in Ukraine like that. That will be happening in every one of our body every day. So if you do the exercise, that inflammation get reduced, there will not be a war zone. It helps in the maintaining the muscle strength, muscle girth, and also it produces the chemical called endorphins. Endorphins are benzodiazepines like tranquilizers, which are more powerful than the synthetic tranquilizer what we have discovered so far. But it can only be achieved and released from within by doing the physical exercise and also by doing the meditation. Because of all of these positive things, we'll also have better confidence, better performance. And I always say this, just by devoting half an hour to 45 minutes of your time, when you sit down to eat, you really enjoy the food rather than feeling guilty to eat the food. That is one of the rewards what we can have to enjoy the food. So what are the benefits which I already mentioned to you? Weight control, mental alertness, decrease in the blood pressure, reduces the inflammation, which is the basic reason why the cancers are reduced. Increase in endorphins, I mentioned to you, fitness of the heart and all of these things. So I will concentrate on the breast cancer. Even though multiple myeloma, polymyalgia, all of these arthritic conditions, they are emotionally related. And also because we do not do the exercise, the inflammation does not get healed on a regular basis. Okay, by doing this exercise, that inflammation reduction prevents a lot of cancers. But there is an excellent study done in Norway, in Tromsø University in Norway. I would like to share that with you. So this is a study done in Norway. Not many studies have been done because there is no money in this. Okay, so they selected about 25,624 people. So all social groups, premenopausal and postmenopausal women they have selected. They followed this group for 13.7 years. And the duration of the exercise was 3 to 5 years. 3 to 5 years, 3 times a week only, 3 times a week. To their surprise, what they found was at the end of 13 years, those who participate in the exercise, there is a reduction of breast cancer by 37%. Just half an hour of exercise 3 times a week reduce the incidence of breast cancer by 37%. There is no medication invented to produce even 5% of any cancers. So this is a very important thing. There are a lot of hormonal theories. I will not go into the details at this stage. And so we realized why we need to do the warm-up. So now I would like to explain to you scientifically why we should do the cooling down. For example, when we are doing you did the warm-up, and then we did the aerobic exercise. When we are doing the aerobic exercise, our body demands are very high, muscles are contracting at a higher rate, heart is beating at a higher rate, lungs are performing at a higher rate, all of these things are happening, and the temperature also increased. For example, this particular muscle, all the muscles in the body will be warmer, all the blood vessels inside are opened up, and the circulation is going into all small blood vessels. And then the muscles are pumping back as an outside pump, heart is pumping back as an inside pump. We have a central pump, we have an external pump. This is what is happening. When we stop doing the exercise, this is pumping, but this is not pumping because we are not exercising. And the blood which is accumulated in the muscles, it will take some time for it to gradually squeezing it out and bring it back to the general circulation. If you do not give that time of 5 to 10 minutes for all the blood to come back to the general circulation, and majority of the people and some of the people, they will go on and jump into the hot sauna or a steam bath and other things. What that will do, already there is a minimal amount of blood in the general circulation because quite a good amount of blood is sitting inside the muscles. When we are doing the exercise, each muscles can accommodate between 70 to 80% more blood when it is not doing the exercise. You can imagine how much of blood is all over the muscles in the body here. And then what happens is, if they go to the steam bath and other things, the minimally available blood in the general circulation is get diverted into the non-essential tissues like the skin and stealing away the very minimal blood which is essential for the vital organ like the brain, the heart and other things. And people do end up with strokes, heart attack or sudden death. In Norway, they call it as a sauna death. So that is the reason we need to do the cooling down soon after the exercise for 5 to 10 minutes. And also during the cooling down session, of course, you are all familiar with the Shavasana, right? Shavasana. So use the time for you to develop a mental concentration on different parts of the body and then heal yourself through the energy. And then you are preparing ourselves for the meditation and pranayama when we get ready. And then also you are helping the blood to pull back into the general circulation. That way catastrophe is reduced. So basically what we are discussing here, by devoting 30 minutes of time early in the morning, 90% of the people who start this activity before they start the routine work are very successful. Those who have said, I will do that during the lunch time, I will do it during the dinner time and other things, 95% of them are all failures. Okay, if they can do that for minimum of 3 to 6 months, for them to be able to see what is the benefit they can get from within instead of depending on zillions of supplements, going and having a repeated blood test, going to exotic centers and getting the massages done and all that. These are all temporary relief systems, but inherent relief system is within your own self by doing this discipline. What I would say, we have the information. If you have the motivation, we can have a better performance. So with that, I will stop and then, I'm open for any questions. Hope I did not exceed your time.
And
Yeah.
this is a perfect. Now, what kind of exercises are we talking about here, Dr. Murthy? Are we talking about aerobic exercises or any exercises? Is
Okay.
it walking?
That,
If you can go into that, would appreciate
that is
that.
a very good question. Warm up is, from head to toe, there is a specific exercise protocol I have. So all the muscles from the frontal hair, muscles all the way to the toe muscles need to be increased, need to be exercised, including the eye muscles. When we do the warm up, we do the chest muscles and the hand muscles and the leg muscles, but some of the facial muscles also need the exercise, warm up. Some of the eye muscles needs the exercise. So there is a specific steps of exercises. It takes exactly 7 minutes. It takes only 7 minutes to warm up all the muscles from the body. That is the warm up session.
Okay.
In aerobics, what is defined as a aerobics is we bring the heart rate to 140 to 160 depending on the age group. And you maintain that heart rate for a minimum of 15 to 20 minutes to get the maximum aerobic benefit or the cardiac benefit. So that is the aerobic. So that could be cycling, that could be swimming, that could be walking, fast walking, jogging, any of those things, but it has to be a continuous exercise. Weights is not aerobics because we lift the weight and rest. We lift the weights and rest. So this is the intermittent aerobics. It is not a continuous aerobics. Continuous aerobics has to be minimum of 20 minutes.
So it could be the 7 minutes of warming up that you're saying, then followed by, it could be as simple as fast walking for 20 minutes, brisk
Correct.
walking for 20 minutes,
Yeah,
and followed by a shavasana, and then the rest of the processes. Okay,
correct.
understand. It doesn't seem that hard to implement in one's life.
No, it is not. Once they are disciplined to do that, if they don't do that, they feel very guilty. And have been instituting this principle for last 25 years. And I've given this talk in England, in India, of course, and also in Beijing University in China.
Mhm.
I've given people who have practiced this on a consistent basis. They have been able to overcome a lot of chronic illnesses. For example, one of this program, I gave it to her, a patient called with a migraine attack. Very successful, elegant family, came from came from New Jersey. This is about 25 years ago. When I saw her, she was very elegant and very helpful people to the society. Her husband is a successful executive, flying in his own plane and own boats and all of those things. So what she had was migraine headache. 3 days a week, she would lock herself in a room. And then when she gets the headache, she goes to the chiropractor to get a cranial massage. And she has been seeing the neurologist. He has given her amitriptyline, which is a antidepressant. Normally we give 5 milligram. She was given 10 milligram. She was taking it every day. And then she was given a Tylenol number 3 and also naproxen, which is an anti-inflammatory medication. And once a month, whenever she gets this headache, she would go to the chiropractor to get the cranial massage. This is her routine. Okay, when I saw her, I thought, there should be something different. We can help this lady because she is young. She is very helpful to the society. She is suffering like this. And then I gave this program to her with the condition she should do this minimum of 6 months. And also, if she misses even one day, she need to pay a fine of $5 and keep the count. And then she paid that amount of money every month when she comes to see me. But she will write a check. Those days, we used to use checks. Nowadays, we don't use it. Okay, write a check to the charity of her choice. But we will mail the check to the charity. So that is to take away their procrastination. That's what I did. She agreed to that. You will not believe, within 1 month, she was able to discontinue her naproxen. And after 1 month, amitriptyline was gone. That is the antidepressant. She was taking it for 10 years. And then after that, the Tylenol number 3, whatever she was taking, she did not. Within 2 months, she was off all the medication. And if she did get any headache, she would not even call it as a migraine. If she did get a headache, she would take a Tylenol or an aspirin. That is the end of it. She was very motivated to do that. And she continued the same way for 4 months because we have the condition of 6 months, right? So she was very happy and everything. So Thanksgiving comes, she goes to Key West in her boat, and she was very busy organizing everything. For 4 days, she did not do the exercise. Okay, even though she paid the fine, but she got the headache too. So after about a month, one of her friend had a triplet in New York. She went to help the mother, and she did not have the time to do the exercise for a week. Again, she got the migraine headache. So she was shown how important it is to have this discipline. And then by doing it, how it operates physiologically within our body, it is very difficult to scientifically document everything. You see,
Well, she had the empirical evidence in her own body to tell her it's working or not working, right?
Correct.
She had that.
It is a subjective interpretation, but objectively, if you say what hormone was released, what catecholamines were released, how much of the cortisol, all of those things, will not be able to have it. As you rightly said, subjective information is paramount importance than the biochemical information. So she did that. And even now, one day she came and then said, I want to share something with you, Dr. Murthy. For the last 10 years, being such a successful society, whenever they go to these elegant parties, and she's a beautiful looking woman, so everybody wants to come and chat with her. She said, I never enjoyed going to the parties, doctor, because I would never know when my migraine can hit when I'm in the party. And if that hits, I cannot perform. I did not want to show a bad side of myself to the people who wants to talk to me. And for the first time, I'm enjoying my big parties with the great, enjoyment. That is what she said.
That's beautiful. So, Dr. Murthy, at some point, will you show us, maybe if not today, next Sunday when we get together again, would you show us the 7-minute, could you show us the exercises, the specific exercises, or share a pamphlet, or how do we get enrolled in your program?
Okay, I used to do that when I was presenting this program face to face. I have a person, I will give the contact information, they will be able to show it to you.
All right, that would be terrific. If you could give us that information, we'll pass it on to our viewers next time, and then maybe have another session where that person can actually show us that, because you're right now setting the context of it. Then we need to bring it into our lives. So we need to have another session where we show people how they can adopt that in their lives completely.
Yes, correct. Because this will require a much different setting for them to show what they are doing on the forehead, what they are doing on the eyes, what they are doing on the facial muscles, neck muscles, chest muscles, arm muscles, abdominal muscles, and the breathing pattern, all of that, it is quite a bit involved. But once they know what are the things they have to do, it will be very easy, 7 minutes. Wonderful to see the grandkids. Wonderful to see the grandkids.
It's it's beautiful. So we'll do that. And what we're going to do, any other questions, guys, because we're going to have a second session with Dr. Murthy, which will not be so rushed. And since we have limited participants, feel free to ask your questions, and you'll have another opportunity on the 17th. Which is next Sunday at 9:30 to 11 o'clock. It'll be exactly 90 minutes, and we will have a session which will go into a quick summary of what we talked about today, and then go into the emotional, mental part of it as well, intellectual part of it.
Dr. Murthy, I just want to share some information about Mother Earth projects. There's an organization called Bhumi Global.
Yes.
Bhumi Global, okay.
Yeah, Gopal Patel, originally from UK. He moved here, and the Murli Balaji, I think maybe he Your son might know him. He used to work with HAF, Murli Balaji as a education director. So they are involved with the Bhumi Global. So maybe you can search on the website Bhumi Global. So if you need introduction, I can introduce them to you too.
Yeah, so I was also thinking the same thing, Shekharji, that we'll introduce Gopalji and Halgirji together. And maybe we have a session with both of them together at some point where they can talk about their different organizations, and there's synergy to be had because they're both really, and even I have someone in the UN who is also into this. So we'll try and organize some things, Murthyji, for to bring the people who are all earth-loving, planet-loving people together to move the cause.
Agree. I will appreciate that. I will appreciate that. And also, what with the scope, next time I'll discuss that with you. We want to show the people in a scientific manner the spiritual energy of the Mother Earth and the cosmic energy. We talk about cosmic energy, but we have no way of knowing how it is impacting each one of us. I have a technique, I have a system to show how the individual energy is changed after they have done A, B, and C, concentrating on the Mother Earth. So how the cosmic energy is able to influence their physical energy and also the mental relaxation. I have it in numbers, statistical numbers I have it, and it is very easy to demonstrate it on each person so that they can believe in it. They can believe in it, especially for children. As you were saying,
Yeah,
children need to be impacted. When we show they did this and this, their energy, let us say, was 5. After they have done these spiritual exercises, it is 10. There is no reason to be not to believe that, because it is their own energy they are testing on themselves. This is what I will share that with you next time.
That'll be beautiful. Absolutely beautiful.
Namaste,
Any
Dr.
other questions, guys?
Thank you. Thank you.
Good to see you. Good to see you.
Thank you. Thank you, sir.
Namaste, Murthyji. How are you?
Oh, I'm fine. We just complete
call and presenting this. And this energy thing, I remember having done this with you, it was almost 20 years ago at your office. I remember that when you were beginning to test this and try this, and I was one of your, I think you call it patients or your study subjects that you have worked this on, and I can vouch for it that it does really work. So I could not attend much of your lecture today because we are having our first course in Natural Health Sciences by Dr. Arun Sharma ji. You know him very well.
Yes.
We are kicking off the this thing, summer. I mean, not summer course, but this Natural Health Science courses today.
Oh, so, very important. Very important.
Moment we sign off with you, the course will be starting again on Zoom on the same.
Okay.
Yeah, and that's to many thanks, Dr. Murthy. We'll see you again next Sunday. Thank you for all your wisdom, and thank you for all your contributions you're making to the planet.
Okay.
Namaskaram.
Thank you very much.
Thank you, everybody. Happy Ram Navami to all.
Yeah, thank you, and thank you for the opportunity.
Thank you, sir. Thank you. Namaskaram.
Namaskar.